Hi everybody, welcome to the Test Anxiety Workshop. We will be going over what test anxiety is and how to recognize test anxiety symptoms and what strategies and tricks you could use to lessen or overcome test anxiety. In this workshop, you will learn what is test anxiety, what are the symptoms, how to address the symptoms of test anxiety and types of unhelpful thinking, and how to modify your thoughts to reduce anxiety. And lastly, how to prepare for an exam, what to do on exam day, and what to do after an exam. So first, let's talk about what test anxiety is. Test anxiety happens when we experience different thoughts, feelings, and physical symptoms that interferes with our ability to apply our knowledge on a test or an exam. Test anxiety is not anxiety that arises from lack of studying or preparation for a test, but rather it emerges even if you're fully prepared for an exam. It's normal to feel anxious about a test we are unprepared for because the fear of not knowing the answer or failing the test is possible and therefore fitting for the situation. However, if we experience anxiety about a test despite taking notes, studying, and doing all that we can do to prepare, this is not fitting for the situation, and this will be what we're going to talk about in today's workshop. There are many different types of symptoms that can happen when we are experiencing test anxiety. One may experience a few or several of these symptoms in these different categories. We can sort these symptoms into 3 categories, which are physical, emotional, and cognitive symptoms. Some physical signs of test anxiety include, but are not limited to, pounding heart, quick breathing, dry mouth, and sweating and trembling hands. Emotional symptoms include panic, fear, anger, wanting to cry, and helplessness. Cognitive symptoms include going blank, difficulty understanding and reading questions, and loss of focus. For this reason, test anxiety can negatively affect your ability to retrieve information, even if you know it, and consequently make it difficult to focus on the test despite knowing the content. It is important to remember that anxiety is not always a bad thing. When anxiety is low, we may feel bored, struggle with our attention, and our performance suffers. Likewise, when anxiety is too high, we can have difficulties with our performance due to difficulties with focus. According to the Yerkes-Dodson law, the optimal level of arousal is when stress is within a moderate range, not too high and not too low. The optimal amount of anxiety is motivating. If we think of a hockey player preparing for a big game, they often experience some anxiety in anticipation of starting the game, and once they start playing, that anxiety may be motivating, and they describe the feeling as in the zone or experience a flow state. This is what we are talking about when we are describing optimal performance. If you are dealing with physical symptoms of test anxiety, here are some strategies to help reduce these symptoms. These strategies are best practiced when not feeling anxious and built into your routine and used on a regular basis so that you can access them when you feel like you need them the most, which is oftentimes prior or during the exam. One simple method to address your test anxiety is to use breath retraining. There are several different types of breathing techniques. We can use this technique to lower the heart rate, calm the mind, and to help stabilize yourself. Start by breathing in through your nose and into your abdomen for 5 counts. Then hold your breath in the abdomen for 5 counts and slowly releasing breathing out through the mouth for 5 counts. Complete this breathing pattern 10 times. When breathing, try to focus on your breath, noticing it as it moves in and out of your body. By doing this, you can focus on the present moment instead of unhelpful thoughts, which can lead you to start feeling anxious. Next, we have relaxing imagery. When using relaxing imagery, please ensure that you use either a script or a relaxing mental image. For example, you could think of a beach and calming waves of the ocean, or you could think about other things that relax you, such as fishing on a pond, or visualizing clear blue skies, or a bunch of puppies. Pick anything that you find relaxing. This can be very individual for each of us. Pay attention to your senses as you connect with the image. What do you see? What colors do you see in the image? What do you hear? What can you smell? What do you feel? Is there a taste? Take your time to focus on each part of the image. Next, we have progressive muscle relaxation, which is another tool you can use to reduce your anxiety. This strategy involves breathing in while simultaneously tensing different muscle groups in your body. By breathing in tandem with tensing your muscles, this can help release tension and communicate to your body and nervous system to relax. So first, begin by breathing in through your nose and at the same time tensing the muscles in your feet as though you're trying to pick up pencils with your toes. Second, hold this tension and your breath for 4 to 10 seconds. And lastly, release and relax for 10 to 20 seconds before you work on the next muscle group. Notice the difference between how the muscles feel when they are tense and how they feel when they are relaxed. Continue this pattern of tension and release with each muscle group in your body, starting moving from your feet up to your head. The different muscle groups you will target include your quads, your thighs, hips and buttocks, stomach, back, biceps and upper arm, wrist and forearm, hands, shoulder, and finally your face. When you are finished with all of these muscle groups, count backwards from 5 to 1 to bring your focus back to present. Please be sure not to continue with this activity if you feel any pain or if you have any physical injuries. It is important to remember that our thoughts have a huge impact on how we feel and how we behave. If we have the thought, I need to get an A+ or my life is over, we are likely to start to notice our anxiety kick in, and we might start to feel our heart rate increase, tension in our chest, quick shallow breaths. We then might notice that we start ruminating on how much we don't know and not answering any questions on the test, or potentially our mind might go blank and we freeze. In this example, the thought we have, I need to get an A+ or my life is over, shapes how we feel, which is anxiety and panic, and it also affects how we behave, which is freezing and ruminating on how much we don't know. By becoming aware of the way we are thinking, we can start to notice when we are engaging in unhelpful thinking patterns, and we can begin to assess the validity and helpfulness of these patterns and to start challenging them so that anxiety doesn't take hold. The first step is to be able to identify what thought patterns are contributing to feeling anxious. These different unhelpful thinking patterns are common patterns that we can think of as thinking traps, because when we get stuck in this kind of thinking, it often leads to feeling anxious. Let's walk through some of these together. The first one is mind reading, which is you assume that you know what other people think without having sufficient evidence of their thoughts. For example, you might think the prof thinks I'm stupid. Second one is fortune telling, so you predict the future negatively, assuming that things will get worse or that there is danger ahead. For example, you might think to yourself, I'll fail the exam or I won't get a job. Catastrophizing is next. This is when you believe that what has happened or what will happen will be so awful and unbearable that you won't be able to stand it. Oftentimes thinking of the worst case scenario. For example, you might say, if I fail the exam, then I'm going to fail the course, and then I won't get a job, and I'm going to be homeless on the street. Fourth one is labeling. You assign global negative traits to yourself and others. For example, I'm not smart, or I'm a failure, or he's a rotten person. Next, we have discounting positives, which is when you claim that the positive things you or others do are trivial. For example, you might say, when I get good marks, it's because the test was easy. Next, we have negative filtering. This is when you focus almost exclusively on the negatives and seldom notice the positives. For example, focusing on all of the times you failed, or on all of the missteps that you made in the past without acknowledging your successes. Overgeneralizing is next. This is when you perceive a global pattern of negatives on the basis of a single incident. For example, this always happens to me, or I never do well on tests. Dichotomous thinking is next. This is when you view events or people in all or nothing or black and white terms. For example, I failed the test, so I am a failure. Are any of these thinking patterns resonating with you? If you recognized any of them, it can be helpful to start naming the thinking pattern when it shows up, or in other words, catching it. For example, oh, there's my mind overgeneralizing again, or there's fortune telling. After we have named the unhelpful thinking style that we are engaging in, we can then start to examine or check it. This means we look for evidence for and against the thought. For example, the thought might be, I am going to fail this math exam and I will have to drop out of university. The unhelpful thinking style might be fortune telling, which is when you're forecasting the future. There isn't a way to know with certainty if you will fail or if you will not fail. We can check this thought by asking ourselves, what is the evidence for this thought? For example, we might identify that in the past I have done poorly on math exams, or I did not study enough for this exam. We can then ask ourselves, what is the evidence against the thought? Last year, I studied hard for my math test and I was able to pass it. Or another evidence could be, if I fail this exam, it doesn't mean that I will fail my entire degree. I am doing well in my history class. We might then ask, is this the only way to view this situation? So no, I might fail or do poorly on the exam. And if I do, I can use this as a learning opportunity to study earlier for my exam, seek out a tutor, go to the prof's office hours, or you can say, at this moment, I do not have control over how much I studied, or I can only do my best with what I know. Or you could say, failing one test doesn't mean I have to drop out of university. Or you might have to remind yourself that making mistakes is a part of being a human being. Another question we might ask ourselves is, what are the advantages of changing this thought? For example, you can think to yourself, changing this thought would allow me to focus on what I do have control over and let go of what I do not have control over at this point in time. It will allow me to be present for the exam. It may be helpful to ask, how does this thought help or harm me? So you could say it helps motivates me, but it also harms me by narrowing my options. Considering the worst case scenario increases my anxiety, which gets in the way of my ability to focus on the exam and focus on what I do know. I can then ask myself, what would I tell someone else in a similar situation? So you would say, do your best, focus on the exam and what you do know, not what you don't know. Be gentle with yourself. Doing poorly on one exam doesn't mean it's the end of your university career or dictate how smart you are. So going through this set of questions can help us check the validity or helpfulness of the thoughts that we have. After you've answered the previous questions, it's now time to consider how you might adapt to the original thought. For example, if my thought was I'm going to fail this math exam and I will have to drop out of university, we might consider changing it to I have struggled on tests before and I did not study as much as I hoped to. I will go into the exam with the knowledge I do have and focus on the questions I do know. If I fail or do poorly, I will make a game plan after the exam on my next steps. Right now, the only thing in my control is to do the best that I can with the knowledge that I have. So by changing our unhelpful thought to something more measured, we can help minimize the anxiety we are experiencing and free up a space to be able to focus on what is the most important to us without the added pressure. Adjusting our mindset is an important step in reducing and preventing test anxiety. While tests do matter, they are not the only things that reflect your value as a person. It's important to strive for excellence, but understand that no one is perfect. By using a growth mindset that focuses on learning from mistakes and thinking of failures as an opportunity to grow, one can bounce back from experiences where we feel like we didn't perform as well as we hoped. This is in contrast to a fixed mindset, which focuses on seeing our abilities as a fixed trait. No one will get everything right, and by accepting this fact, you can focus on being the best you can be and not focus on comparing yourself with others. Manage your worries. It is normal to feel anxious about the things we care about. We want to do well on a test because we want to do well in school and get a fulfilling career. A little bit of anxiety is normal. However, if it is getting in the way of your performance, it's no longer motivating and we need to try a different strategy. So pace yourself. If there are lots of questions you don't know, focus on the ones you do know first. Take it one question at a time. Lastly, what do you need to make your environment comfortable? Have you eaten before the exam? Have you slept? Make sure your basic physical and mental needs are being met before you enter the exam room. Prior to an exam, reviewing the content extensively can reduce your anxiety. By being more prepared, you're less likely to panic and anxiety will be less likely to emerge. There are 3 ways you can review before an exam to increase your chance of success and reduce your anxiety about the test or exam. Daily review. So this happens when you spend 5 to 10 minutes per subject doing a quick overview of your notes before and after class. Before moving on to the next subject, you make sure that you have an understanding of the topic. This is helpful for starting to build a habit of reviewing the material early on, well before the exam. And then you have the weekly review, which happens where you spend 1 hour per subject once a week. You review class notes, you do assigned readings, and you answer practice questions. And lastly, you do a major review. This type of review usually happens 1 week before the exam. The duration of studying will increase to 2 to 5 hours a day with short breaks every hour. To increase effectiveness, review the most difficult content at the start. If you're studying for a longer period of time and breaks have begun to lose its effectiveness, completely stop studying and allow for a period of time for your brain to reset. By taking the necessary steps to ensure you understand the material, one can avoid the risk of feeling underprepared. While there are no guarantees that all of this review will get you a high mark, just knowing that you did all of that just can give you a peace of mind. The thoughts, I wish I studied the topic more, or I forgot to read up on this, are less likely to appear if reviewing is done properly. These are some additional strategies when preparing for the exam. Prior to an exam, if the professor provides a study guide, use it. Ask the teacher more details about the exam. Are they planning to ask questions from the lectures or the textbook or both? What types of questions are they going to ask? Is it multiple choice, short answer, or long answer? Depending on this, you might strategize how you're going to study, and then ask them how long the exam is, What is it worth? All of these questions are important to consider. During class, look for emphasized points because those could be clues for what's going to be on the test. What ideas are repeated? What hints has the prof dropped that might indicate that certain points are important? Consider how you learn best. Depending on if you're a visual, auditory, or a verbal learner, different study strategies might better suit you. Do you study best by making cue cards, drawing images of concepts, or writing point form notes? Lastly, if available, using practice tests will give you a better idea of what the exam is going to look like. Alternatively, you can draw up your own possible questions and then answer them. There are several different things to take into account on exam day to ensure you feel prepared and to minimize your anxiety. Arrive a couple minutes early so that you can have time to relax and prepare yourself mentally. Try to not talk to people about possible exam questions. This can heighten your anxiety. Once the exam starts, scan the entire exam over so you can get an idea about the questions and their values, as well as where you might spend the bulk of your time. Focus on answering the questions that are easiest first, and then moving on to the more challenging ones. And most importantly, remain calm. If you do all of these steps, you can reduce the chance of anxiety emerging. After an exam, you should reward your efforts. The reward can be whatever you desire and within your abilities to attain. For example, it could be shopping with friends. You might also reflect on what you did right and what went well. Before studying for another exam, take some time off to relax and recharge so that your brain has time to settle and recover. And when you get your test back, this is the time to be able to reflect on any mistakes and to learn from your errors. If test anxiety continues to be an issue and you need more support, feel free to reach out to McEwen Wellness and Psychological Services or the Peer Support Center. Thank you for listening to our workshop. We hope that you learned some new tips and strategies on how you can improve and lower your test anxiety. Good luck in your studies, and thank you for your time.